Welcome back to The Blend. The holidays are a great time for families to celebrate, give thanks, and reflect. In addition to sharing good food and great company, special occasions like Thanksgiving provide the perfect opportunity to talk about your health with everybody around.
Joining us now to discuss the importance of advance directives and how to bring the topic up is Healthcare Partners clinical educator Ellen Aliberti. Good morning and welcome back. How are you?
Good morning. I'm well. Happy holidays.
Same to you.
Happy Thanksgiving.
Yes.
Now, first of all, tell us, what is an advance directive?
Thank you. So an advance directive is a document that allows you to make treatment choices that you would like to have in the event that you can't represent yourself, you're too sick or unable to speak them. So that's in essence what an advance directive
your
is.
wishes written on paper.
Your wishes written on paper so we can still follow through even if you can't.
And you say this is a good time of the year when you're having a family gathering to broach the subject.
It's such a great time of the year. All the families together. You know, it's not a crisis time. You have the opportunity to speak with your family, and it's a lot easier than, you know, in the event there would be a crisis. So it's a perfect time.
Now, last time you were on off-air, you gave us a special assignment to complete our advance directives before today's segment. I have mine. I have filled it out front to back. It asks some questions that are a little difficult to think of. You know, well, like, they're not questions you really want to tackle, but you have to. These are things you have to tackle, really.
Yes. First of all, Sean,
passing in my homework.
I want to, no, not to me. I want to congratulate you on finishing it.
Thank
Dow.
you.
Bad girl, bad girl.
Yes, I want to hassle you about it. But yeah, the 5 wishes is an advance directive that Healthcare Partners promotes because it goes beyond identifying what your treatment choices would be and who your representative would be. This one goes beyond it, talks about how do you want to be comforted, what do you want people to know about you, and so forth. So it's a lot softer. I'm surprised you thought it was difficult.
What do you do with this now that you have completed it?
Right. Well, first of all, you have to have it witnessed by 2 people who are not invested in your estate or your decisions.
Yeah.
And then you got to make sure that you've got your physician has a copy, and if in the event you have to go to the hospital, you want to make sure you bring a copy with you so they can represent you appropriately.
Of course. Now, filling it out isn't difficult.
Yes.
It's thinking of the questions and thinking of your mortality, really.
Yes.
That can be a little difficult, but it's something that has to be done.
I think it has to be done, and you know, Healthcare Partners kind of couches it as a gift you give yourself and your family members, because think about it, I don't want to have to make decisions when I'm going to have to guess for you. This lays it out, and so I can represent, you know, my family member appropriately.
This is something that has happened in my family more times than I'd like to admit, where the family ends up fighting each other over what they think is the best for the person that's in the need of the help.
And you know what?
It should never be that way.
It shouldn't be that way, and that's why we say fill out your advance directive, give a gift to yourself, give a gift to your family, and the holidays is a perfect time. Find somebody who supports your wishes to help you have that discussion, because it can be difficult.
And this is not a will, this is a health directive, so it answers questions about your health, right?
Correct.
That's something that's separate, that's a will.
Right, the will is different. Well, you can have advance directive for financial means or for healthcare matters, so there's actually 2 components. They can be separate or they can be in the same document.
Now, for people who don't have this in front of them, what kind of questions are asked in this health directive?
One of the things I want to capitalize on today is when you identify your representative, you want somebody who's not necessarily so dependent on you that they don't want to represent your wishes appropriately.
Yeah.
So you've got to really think about someone you trust, who supports your wishes no matter what they are.
But it's so fully ensconced in your life.
Exactly.
Yeah.
And someone who is going to support you through the whole thing, that can.
We know Healthcare Partners, they offer a wide variety of services to the senior community.
Yes.
What are some of the special services that you provide?
Thank you. So Healthcare Partners, we embrace the total care model, which is a comprehensive care model for our seniors. We can have doctors, physicians, care coordinators. We can assist people with transportation, medication assistance, and also support their caregivers and so forth, and helping them maximize their health care benefits and their health care.
And right now, open enrollment is going on. Why is this so important?
So open enrollment goes through December 7th, so you just have a few more weeks to focus on it. But this is a really important time because seniors can decide, make different decisions about where they want to address their Medicare. You know, do they need more medication? Are they looking for a better transportation benefit? It's a really important time, seniors. Go, and so do your homework, www.medicare.gov, and also healthcarepartnersnv.com.
Awesome.
Can we download this online too?
Yes, you can. You can download that, but if you're a Healthcare Partners patient, you can go to your Healthcare Partners
and they'll
clinic,
have it on hand.
and we have them. We give them out to everybody and so forth because it's so important.
Ellen, it's a pleasure. Thank you so much.
Thank you so much.
All right, for more information on discussing advanced directives, to learn more about the open enrollment process, no, it's okay. Just head to the website on your screen. Stay with us. We'll be back.